Welcome to the Deep Dive. Today we're going to be taking a closer look at depressive disorders. We're using Depressive Disorders 2nd edition, edited by Mario Mage and Norman Sartorius as our guide. It's a fascinating collection of chapters by a bunch of different experts, and it really gives us a good overview of all things, well, depressive disorders.
Yeah, it really covers a lot of ground. We'll be talking about how we even define these disorders, the different types, diagnosis, treatment.
Yeah, so before we jump into all of that, I think it makes sense to start with the basics,
Right.
What exactly is depression? I mean, we all use the word, right? Kind of casually.
Mhm.
But clinically speaking, what are we talking about here?
That's a great place to start. And you'd think with all the research and all the attention this gets, there'd be a simple answer.
Yeah.
But not really. One of the things the book highlights is this ongoing debate. Is depression a spectrum or a distinct category?
Okay, so that makes sense. Like, is it a range of experiences or a very specific, thing with clear boundaries?
Exactly. And that really complicates how we define it. It's not just about feeling sad, is it?
Right, and the book even mentions this term, depressio sine depressione, which, I gotta be honest, sounds kind of like a riddle.
It is a fascinating concept. Basically, it refers to cases where someone has all the classic symptoms of depression, the changes in sleep, appetite, energy, all of that, but they deny feeling sad.
So they have all the signs, but they
Right.
don't actually feel sad. That seems like it would throw a wrench in the diagnostic process.
It really does. It challenges this assumption that sadness is like the defining feature of depression. So if we're not just relying on someone saying, yeah, I feel sad, how do we figure out where to draw the line? When does normal sadness or grief become a depressive disorder?
Right, because we all experience sadness and grief. That's a part of life.
Absolutely. So both the ICD-10, that's the International Classification of Diseases, and the DSM-IV, which is the Diagnostic and Statistical Manual of Mental Disorders, they both rely on specific criteria. They
Right.
look at the number of symptoms present and how long they've been going on.
So it's kind of a checklist plus a timeline. But even with that, there's still room for debate.
Right. Oh, absolutely. Some experts argue that these rigid cutoffs, they don't really capture the whole picture. They might miss people who are really struggling but don't quite meet those criteria. And then you have cases like depressio sana depressione, which really highlight how subjective the experience can be. So it's a reminder that clinical judgment is super important. It's not just about checking boxes.
It's like those online quizzes that say, do you have this?
Yeah.
They might be a starting point, but they're not giving you the full story.
Perfect analogy. Diagnosis requires really understanding the individual, their history, their current situation, and really listening to their experience.
Okay, and speaking of different experiences, the book gets into all these different types of depressive disorders. And it's not just, a one-size-fits-all feeling down, right?
Yeah. Right. It outlines a whole bunch of distinct types. You've got major depressive disorder, MDD, dysthymia disorder, which is like a chronic low-grade depression, atypical depression, which has some unique features like increased appetite or sensitivity to rejection.
Wow, there's so many variations.
And there are. You also have melancholic depression, a very severe form with, a loss of pleasure in almost all activities. Psychotic depression, where you have depression along with hallucinations or delusions. It's a wide range.
It really does seem like depression is more of an umbrella term that covers all these different experiences. And then you have to consider all the other things that can contribute to depression or be associated with it.
Absolutely. The book also explores depression that occurs alongside medical conditions, things like thyroid disorders or heart disease. And then there's depression related to substance use, which can be really hard to untangle, like which came first?
Right, the chicken or the egg.
Yeah.
So we've got all these different types of depression, potential contributing factors, and a diagnostic process that is way more nuanced than just checking off a list of symptoms.
Mhm.
Kind of makes you realize how tricky it can be to accurately diagnose.
Yeah. It's not always straightforward, that's for sure. And that actually leads us perfectly into the next part of our conversation. What specific tools and challenges do clinicians face when they're trying to diagnose someone with a depressive disorder?
Okay, so stay tuned for part 2 where we'll delve into that diagnostic toolkit and all the complexities that come with it. Okay, so welcome back. We just talked about how tricky it can be to actually pinpoint and diagnose depression. So now let's get into how it's actually done. What are the tools, what's in the clinician's toolkit, so to speak, to actually diagnose someone with a depressive disorder?
It's a really multi-layered process, and the book talks about a few different diagnostic tools. One thing that clinicians use is called a structured interview.
Okay, so not just like sitting down and chatting, I'm guessing.
Right. It's more systematic. Two of the common ones are the Schedule for Affective Disorders and Schizophrenia, or CS, and the Structured Clinical Interview for DSM-IV, which is called the SCID. And these provide a standardized way to gather information about the patient's, symptoms and their history, their experiences.
Okay, so it's a way to make sure all the bases are covered.
Yep.
Makes sense. And what else is in that toolkit?
So then you have these self-report questionnaires that you might have seen, like the Beck Depression Inventory and Zung's self-rating depression scale. These are the kinds of things you might fill out in a waiting room.
Right, right. I've definitely seen those, where they ask you to rate how often you experience certain symptoms. But I always wonder, like, how reliable are those? It seems like people could, not be totally honest or maybe interpret the questions differently.
Yeah, that's a really good point. And the book does point out some of the limitations of these scales. One issue is that they can have reduced validity with repeated use.
Okay, so what does that mean?
So basically, if you're filling out the same questionnaire every few weeks, you might start to recognize the questions and maybe adjust your answers unconsciously, even if your symptoms haven't really changed that much.
So they might not be the most accurate way to track progress over time. Interesting. Okay, so we've got structured interviews and self-report questionnaires. What about all those fancy brain scans you hear about? Can't you just, scan someone's brain and see if they have depression?
It would be great if it were that simple. The book does talk about neurobiological tests, but it's not quite that straightforward. One example is the dexamethasone suppression test, or DST. And this measures how your body responds to a synthetic steroid. And, abnormalities in this response can be associated with depression. But there are a lot of other things that can affect the results, too.
Like what?
Well, things like weight loss or certain medications can throw off the results, so it's not a perfect test by any means.
Gotcha. So not as simple as just looking at a scan and seeing, yep, there it is. Okay, so what about those tests that look at serotonin levels? Isn't serotonin like the happy chemical or something?
Right. Serotonin is often associated with mood. But even though we know that serotonin plays a role in depression, these tests haven't given us a definitive answer, unfortunately. We still don't fully understand how serotonin actually works in the brain.
Okay, so those neurochemical tests are still a work in progress.
Yeah.
What about neuroimaging, like MRI and PD scans? Can those tell us anything useful?
So, neuroimaging can show structural and functional changes in the brain, things that are associated with depression, like we might see differences in activity levels in certain parts of the brain, or maybe differences in the size of some brain structures.
So you can actually see those changes. Wow.
Yeah, it's pretty amazing. But the problem is, these changes aren't always unique to depression. They can be present in other conditions too. So we can't just rely on neuroimaging alone to diagnose depression. It's just one piece of the puzzle.
So it really is like detective work, isn't it? Pulling together all these clues from different sources and using, clinical judgment to figure out what's going on.
Yeah, I like that analogy. And the important thing to remember is that a diagnosis should do more than just label someone. It should inform the treatment plan, help predict the course of the disorder, and, give us insight into that individual's history and experiences. It's all connected.
And speaking of treatment, I think that's what a lot of people are really curious about, right? So we've established that there are all these different types of depression. Diagnosis can be tricky. It's more than just feeling sad. So how do we actually help people who are dealing with these disorders?
That's where it gets really interesting, because there are two main approaches. You have the pharmacological treatments, which is basically medication, and then there are the psychotherapeutic approaches, which focus on, talking and working through issues.
Okay, so let's start with the medication side of things. I think when most people think of depression treatment, they think of antidepressants. And the book mentions, a lot of different kinds, right?
It does. It talks about first and second generation antidepressants. So the first generation includes things like the tricyclic antidepressants, the TCAs, and the monoamine oxidase inhibitors, which are the MAOIs. And then second generation includes the selective serotonin reuptake inhibitors, which are better known as the SSRI.
Okay, SSRIs. I feel like those are the ones you hear about most often,
Yeah.
like Prozac and Zoloft and Paxil.
Right, exactly. So what's the difference between all these? They're all targeting neurotransmitters in the brain, which are those chemicals that help brain cells communicate.
Okay, so the messengers carrying messages between neurons.
Yes, exactly. So the TCAs, the older class, they affect multiple neurotransmitters, which can lead to more side effects. But the SSRIs, they're more selective. They primarily target serotonin, so they tend to have fewer and less intense side effects.
So it's about finding the right medication to target those specific imbalances in the brain. But the book also says that there's no one-size-fits-all when it comes to medication, right? So what are some of the challenges there?
Well, one of the big ones is finding the right dosage for each individual. What works for one person might be too much or too little for someone else. And so it often involves a lot of, trial and error, working with a doctor to figure out that sweet spot. And then, of course, there's treatment-resistant depression, where people might try multiple medications and still don't find relief.
Oh, wow. Yeah, that must be so frustrating for, everyone involved.
It is. It can be really tough. But the book does talk about some strategies for those situations, like augmentation therapy, where you add another medication to the antidepressant to boost its effects, or combination therapy, where you use different antidepressants together.
Okay, so even when the first-line treatment doesn't work, there are other options to explore. But medication isn't the only approach, right? You mentioned psychotherapies, too. What are those all about?
Absolutely. And the book goes into quite a bit of detail about different types of therapy that can be really effective. One that you've probably heard of is cognitive behavioral therapy, or CBT.
CBT, yeah, I've definitely heard of that. Can you explain a little bit about how it works?
Sure. Imagine you're wearing glasses with a dark tint. Everything looks gloomy and negative, right? CBT is kind of like taking off those dark glasses and replacing them with clear lenses so you can see things more realistically. It teaches you to challenge those negative thought patterns and replace them with more balanced and helpful thoughts.
So it's like rewiring your brain to think about things in a different way.
Yeah, exactly. It's about recognizing those automatic negative thoughts that pop up and learning how to, talk back to them and replace them with more positive and realistic ones.
Okay, that makes sense. So
Mhm.
what other therapies are there?
There's interpersonal therapy, or IPT, which looks at the role of relationships in depression and how to, improve your communication skills and build stronger connections. And then there's behavioral therapy, which focuses on specific behaviors. So for someone who's really withdrawn, they might work on gradually increasing their social activities, for example.
So kind of like taking baby steps to get back out there.
Exactly, exactly. And, all these therapies, while they're different in their approach, they kind of all share this emphasis on empowerment. They give people tools to understand and manage their own mental health.
Okay, so it's not just about passively receiving treatment. It's about becoming an active participant in your own recovery.
Yes,
Yeah.
exactly. And, there's always been this debate about medication versus therapy, like which one is better, but this book presents a more balanced view. It suggests that combining both approaches can often lead to the best outcomes.
Makes sense. It's probably not a one or the other situation, right? It's about finding what works best for each individual. But I'm curious, does this whole conversation about diagnosis and treatment, does it change when we're talking about depression in different age groups? Like, is depression in a teenager the same as depression in, an older adult?
That's a really important point. Depression can look very different across the lifespan. And the book actually dedicates entire chapters to depression in children and adolescents, and then depression in the elderly, because there are these unique challenges in each age group.
Right, that makes sense. Okay, so let's start with younger folks. Diagnosing depression in kids and teens, that must be so tricky. How do you know if it's just like typical teenage angst and mood swings versus something more serious?
You're right, it can be tough. Teenagers are already going through so much, hormonal changes, social pressures, academic stress. It's a lot. So the book really stresses the importance of distinguishing what's developmentally normal from a clinical depressive disorder. And that involves looking for significant changes in behavior and mood, things that are persistent and are interfering with their ability to function.
So it's not just about how intense the emotions are, it's also about how long they last and how they're affecting their life.
Right. And another layer of complexity is family dynamics. The book talks about how parental depression can really increase a child's risk of developing depression. It's not just genetics, it's the environment, the stress, the learned coping mechanisms. So it really underscores the importance of addressing mental health within the entire family unit.
So it takes a village, right? Okay, so we've talked about diagnosis. What about treatment approaches for kids and teens? Are they different?
Well, the book highlights CBT and IPT as being particularly effective for young people. CBT helps them, challenge those negative thoughts and develop coping skills, and IPT can help them navigate those tricky social and interpersonal dynamics that are so common in adolescence.
Okay, so giving them tools to understand their emotions and relationships. What about medication? Is that something that's commonly used in kids and teens?
That's where things get a little more sensitive. The book acknowledges that using medication in young people is something that's still debated. There are definitely some ethical concerns.
Right. I imagine there are worries about side effects and long-term consequences, especially since their brains are still developing.
Exactly. And the book is very clear that any decision to use medication should be made really carefully, weighing the potential benefits against the risks and involving the family in that decision-making process.
So it's a very individualized decision, not just like a blanket approach. Oh, so we've talked about the challenges of depression in young people. Now let's shift gears to older adults. What are some of the unique things to consider in that age group?
Well, as we get older, physical health problems become more common, right? And those physical health issues can overlap with depression. Sometimes the symptoms look very similar, so that can make diagnosis really tough. Someone might be experiencing fatigue, sleep problems, changes in appetite, and it could be due to an underlying medical condition or it could be depression. It can be hard to tell them apart.
So it's important to look at the whole picture, not just focus on individual symptoms. But even once depression is diagnosed, does treatment look different in older adults?
It often does. The book emphasizes that it's really important to tailor the treatment to the individual's needs and vulnerabilities. Older adults might be more sensitive to side effects of medication, so they might need lower doses.
And their bodies process medications differently as they get older, so those adjustments are really important.
Absolutely. And then there's this whole issue of polypharmacy, which is when people are taking multiple medications for different conditions. That's really common in older adults.
Right, and that increases the risk of interactions between medications, right?
Exactly. So it's crucial that all the healthcare providers involved are communicating with each other.
Yeah, it's a real team effort.
Yeah.
So we've talked about medication. What about psychotherapy? Does that play a role in treating depression in older adults?
Oh, absolutely. Therapy can be incredibly helpful for older adults. They're dealing with so many unique challenges: retirement, maybe the loss of loved ones, declining health, changes in their social roles. Therapies like CBT and problem-solving therapy, or PST, can be really valuable for helping them develop coping mechanisms, to manage stress and grief and all those transitions that come with aging.
Okay, so it's about giving them the tools and support they need to navigate those emotional challenges. It seems like treating depression in older adults requires a really delicate balance of, addressing their physical health, managing medications, and taking care of their emotional well-being.
I think you summed it up perfectly. It's a holistic approach that recognizes that our minds and bodies are interconnected, especially as we age.
Okay, so we've covered a lot today. The many faces of depression, the complexities of diagnoses, all the different treatment options. But there's one more important aspect that we haven't touched on yet, and that's the cost of depression.
Yeah, that's a big one. And this book really goes into the economic burden of this widespread condition. It affects individuals, families, and society as a whole.
Okay, so that's where we'll pick up in our final segment. We're going to explore the economic impact of depression and why it matters so much. And we're back for our final segment of this deep dive into depressive disorders. Yeah. So we've talked about, defining depression, diagnosing it, all the different ways to treat it. But now it's time to get real about the economic impact.
Yeah, it's something we don't always talk about, but it's a huge factor. Depression has a real cost, both for individuals and for society as a whole. And this book, it really delves into those economic realities.
Okay, so let's break it down. What are the main economic costs associated with depression?
Well, we can think about it in terms of direct costs and indirect costs. The direct costs are kind of the most obvious ones, things like, going to the doctor, therapy sessions, hospital stays if needed, and the cost of medication. All of those are, they hit you right in the wallet.
Right. Those are the bills you see piling up. So those are direct costs. Makes sense. What about these indirect costs? What are those all about?
Indirect costs are a little more hidden, but they're just as important. So think about lost productivity at work. Someone who's struggling with depression, they might have trouble concentrating, they might have trouble getting tasks done. Heck, they might even have trouble just getting out of bed and going to work in the first place.
Yeah, depression can really sap your energy and motivation.
It absolutely can. And so all of that translates into lost work hours, missed deadlines, and in some cases, it can even lead to job loss.
Right, so it's not just about the individual suffering. It can have a ripple effect on their livelihood, their financial stability.
Exactly. And then, there's the impact on families and caregivers. Someone who's depressed might need more support, and often that falls on family members or loved ones. And that means maybe taking time off work to help out, dealing with the emotional stress of it all, maybe even facing some financial strain themselves.
Wow, it really is a domino effect, huh? It extends way beyond the person who's actually diagnosed with depression. And you think about how common depression is, I mean, globally, it must add up to a pretty significant amount of money.
Oh, it does. The book actually cites studies that show how much depression costs healthcare systems and national economies all over the world. It's really a major public health issue with these far-reaching economic consequences.
It makes you realize how crucial it is to, make mental health a priority, not just for the sake of individuals, but for the sake of society as a whole. But I think the book also gets into the costs associated with different treatment approaches, right? Like, how do different treatments stack up economically?
Yeah, it looks at how different treatments compare in terms of, their economic impact. One interesting comparison is between those SSRIs and the TCAs, those antidepressants we talked about earlier.
Right, the SSRIs usually have fewer side effects, so they're often
Yeah.
preferred.
Exactly. And because of that, some research suggests that SSRIs, even though they might be more expensive upfront, they might actually be more cost effective in the long run.
Oh, really? How so? I would think fewer side effects would mean less disruption to someone's life, right?
That's exactly it. Someone on SSRIs, they might have fewer side effects, which means they're more likely to actually take the medication consistently, right?
Yeah.
And that leads to better symptom control. It reduces the chances of relapse. And then, they might not need additional medications to manage those side effects. They're less likely to miss work or experience those productivity losses we were talking about.
So it's kind of like an investment.
Yeah.
Even if the SSRIs are more expensive initially, they could end up saving money down the line by preventing all those other costs from, like, spiraling out of control.
It's a really interesting perspective, and it highlights how important it is to think long-term when we're considering treatment costs. Sometimes that upfront investment can actually lead to better economic outcomes overall.
It seems like we need more research to really get a handle on, the full economic picture, especially those naturalistic studies that the book mentions.
Yeah, those are important. Naturalistic studies, they look at people in real-world settings rather than those controlled clinical trials. So it gives you a better sense of how people actually experience and manage their depression and what the real costs are out in the world.
It's real-life data, not just from the lab.
Well, I feel like we've done a pretty deep dive here into this complex world of depressive disorders. We've talked about, the different forms depression can take, how tricky it can be to diagnose, all the different treatment options out there, and then this whole other layer of the economic impact.
It's a lot to take in. This book really lays a great foundation, for understanding the key concepts and challenges.
It really does. But as always, there's so much more to learn. And keep in mind, this book was published back in 2002. A lot has happened since then. I mean, who knows what kind of advancements have been made in research and treatment in the last, 20 plus years? Absolutely. It's an exciting field, and it's constantly evolving. New medications, new therapies, new ways of understanding the brain and how it all works. It's incredible.
So to all our listeners out there, we encourage you to keep learning, keep asking questions, and keep exploring this fascinating world of depressive disorders. Thanks for joining us on the Deep Dive.